Tony, I'm a nursing student. Do you think that you could give me a report on your patient?
Sure. Her name is Shanana O'Connor. She's 34 years old. She's on room 231. She's a full code. She's on a renal diet with a 1500 fluid restriction diet, and she has an allergy to sulfa. She has also suffers from end-stage renal disease, in which she has dialysis 3 times a week for it. She has a history of type 1 diabetes. Originally, she came in with a fever, chills, and general weakness. She also reports an elevated blood glucose readings and a decreased appetite for the past few days. She has a history of recurrent UTIs. She is alert and oriented ×4. Her skin is intact with no issues. Her lungs are clear. She also reports that she's had a decrease in volume and frequency in urination, and her urine has been dark and concentrated. Bowel sounds are present. Her blood pressure is 138 over 78. O2 is 96. Temperature is 101.1. Her heart rate is 95, and her chest X-ray was normal. She has an IV on her right forearm. Her CMP, CBC, and culture are still pending. Her white blood cells were elevated and in her urine analysis, so it was about 15. So she'll be receiving Primaxin for that, which is going to be 100 ml per hour, and then the sodium chloride normal saline, which is going to be continuous at 30 ml per hour.
Why specifically is this client receiving this medication?
The client has a fever and elevated white blood cells in her urine, which indicates she has an infection.
What action does the medication have on the body?
The medication binds to the bacteria cell wall, causing cell death.
When should you question administering the medication?
When the client's receiving penicillin or cephalosporin.
Does the medication have a therapeutic serum level?
No.
Which vital signs must be monitored?
All vital signs are important, but for this specific patient, we want to watch her temperature because it's been elevated.
Which physiological parameters should we monitor?
We're going to monitor for any fluid retention, an increase in white blood cells, rash, wheezing, and anaphylaxis.
What interventions must be taught to the client to ensure the medication is administered safely in the hospital and at home?
You want to teach your patient to report any signs of a superinfection, such as a black furry growth of tongue, vaginal itching or discharge, or loose smelly stools. And then for home, you want to tell her to call her provider to report any of these signs and symptoms.
What are the side effects and potential adverse reactions?
It's going to be nausea, vomiting, diarrhea, hypotension, rash, phlebitis at the IV site, and then an adverse effects would be an anaphylaxis reaction.
How will you know the medication is effective?
When her white blood cells will decrease and her fever will go away.
Thank you.
So now we're going to go in our patient's room. Knock, knock. Hello, I'm Marie. I'm going to be your nurse today, and that's my friend Tony. She's a student nurse. Can you tell me your name and date of birth?
Shanana O'Connor, 34 years
And
old.
do you have any allergies?
Yes, sulfa.
Okay. And then I'm going to compare that to the MAR. So we have Shanana O'Connor, 34 years old, and she has no allergies. Great. Miss Connor, we have some medications for you today. It's going to be the IV antibiotic, which is Primaxin. You do have the right to refuse it. The reason that we're giving you that is because you had elevated white blood cells in your urine. And then you're also receiving the normal saline, to keep you hydrated, which that's going to be continuous. Are you okay with that?
Yes.
Okay. Well, I'll be right back. I'm going to go get the medication ready.
Okay.
So, we're just going to do our rides. So we're going to do our 5 rides. We're going to see if it's the right patient. Shanana O'Connor. Right medication, and we have the sodium chloride and the Primaxin IV. Right route, it's going to be through IV. Right dose, the sodium chloride is going to be at a 30 ml, and then the Primaxin is going to be 100 ml. The right time, okay. And then if I have any questions, I would call pharmacy. And then I also have my David's drug guidebook, which I can just pull up. So if I have any questions or if I want to check any contradictions. And then I'm gonna also have my level 1 student nurse confirm it for me. So
And this is still closed.
it's gonna be
Now I'm gonna open it.
sodium
sterile.
chloride 30
Connected.
ml. Thank you. And then what you want to do before you get this ready, you want to check the expiration date.
And then
If it's any punctures, any leaking,
before I
if
start
it's cloudy, this looks like
this
it's
one,
good.
I have to adjust the
And then I'm just gonna perform some hand hygiene here.
per hour. And Brittany, can you double check for me? Alright. Connected. Put it there. Gonna unclamp.
So get our tubing
Watch
ready.
for 5 drops. 1, 2, 3, 4, 5. Okay. And then I'm going to document for this one and save.
Just get all this on
Checking on preparing my second medication, which is imipenem.
And then I also am gonna make sure that I have the green light here for this, the sodium chloride.
And
Oh,
before I
where did
start-
you go?
Shanana, do you know any side effects of the medication I'm about to give you, imipenem?
So just make sure you have this.
Allergic reactions, but you might have to remind me. Okay, so for some major signs you need to look for is something like rash, itchiness, especially around your IV sites, and if you are having trouble breathing, your face is
So
swelling
we have
up,
the
your
green light for the sodium chloride.
swelling up. Go ahead and press the call light and let me know, okay? Those are the
I'm just gonna put a pair of new gloves now since I touched the computer.
major adverse reaction we don't want. So before I start the medication, we're gonna go ahead and double check with the MAR. Imipenem, 100 milliliter per hour for rate at times 6:30.
So we have
7:30.
this, the tubing here, and then we're just gonna put it and make sure that this is sterile. So, we gotta do, and then there's usually a cap here, but I don't have a cap at the moment, but then you're just gonna puncture it
The
here.
drug guide to see if it is okay to give at this rate. Since she does have renal,
And then make sure that everything is clean, which most tubing originally comes clean, but just, you know, double check it. You don't want this leaking everywhere.
And it seems like the rate is good.
Okay.
It's
And then since I
appropriate.
don't have a machine, I'm gonna do it with a dial flow. So,
I'm gonna prepare it.
and then this usually has a cap too, so it's gonna be sterile.
First I'm going to blow in this bag.
And then let's just make sure that this is set up prime.
Since it is, the imipenem is a,
It just tells us that it's open.
and it's a piggyback, it's a smaller bag, it's gonna, we want it to go and diffuse, and be infused a lot faster.
So
than
you're
the
gonna
normal
unclamp
one.
everything
So
now,
we have to lower this
and then we're
one
just gonna
and
use
let
this
the
trash
do
can
all
to, and then also I have a label here. So
Yep, it's full. So this
you have the
should
little
cap,
label
but
and it
since
just
we don't know,
tells that, you
it's
know,
going
what
to,
time you gave it, give it 2,
be
3
sterile. I
squeeze
have to
it
take
here.
out.
And then
Touch
you're
the
gonna put your
area.
initials, what you're given and the time.
Make sure this is clamped, so we don't
So
have
make
any
sure
bleeding.
everything is on clamp.
Go ahead and tight,
Oops.
like so. Hang it up.
Okay, there you go.
There are about 2 ways to prime this bag. Like this one, I can just do it right here. And another one is basically connecting it to
Okay.
this one, this port.
So we're
And
good
it's called
here.
back prime when I have to lower the bag and so we don't waste any medication. But for now, I'm just gonna
So
go
I'm
ahead
gonna
and
clamp everything.
prime like this. I'm gonna put about halfway fluids in the chamber. That. And then using the
So
bag,
that's all ready. So now we're gonna go into our patient's rooms and then, we're just gonna, before, you know, you go in the room, just do another safety check. So make sure it's the right patient, the right med, the right routes, the right dose, the right time. And then
infusing.
All right, I have your sodium chloride here. Can you confirm your name and date of birth and any allergies?
Shanana O'Connor, 34 years old, and I'm allergic to sulfa.
So we're just gonna do another safety check. Okay, we have the right patient. What did I do? Okay.
Shanana, can you tell me your name and age again?
Yes, Shanana O'Connor, 34 years old.
Do you have any allergies?
Yes, I'm allergic to a sulfa drug.
Alright, thank you. Okay, Shanana O'Connor is on the screen right now. Now I'm gonna put in the codes for the independent.
So I'm gonna connect my patient and then I'm just gonna, you know, like I stated before, I'm gonna do the right patient, the right med, right route, the right dose, the right time. I'm gonna perform hand hygiene.
Okay, I have the green light. Got it? Okay. Alright.
And then,
If I need to go,
so I'm just gonna flush your IV here
can you go ahead?
and then make sure you clean the site. So you're gonna clean it for 15 seconds
15 seconds before I connect it to the independent.
and then, you know, we're gonna make sure that it's unkinked, which this is not, so 15 seconds.
Alright, then I would.
And then you wanna assess the sites for any redness, if it's infiltrated, you know, monitor it. And then for our patients, we're gonna ask him if he feels any pain, so.
Before I clamp, I can just go ahead and.
Okay, and let me know if you feel any pain when I do this, okay?
2, 1,
Okay, it's okay so far.
milliliters
Is it
per
hurting you?
hour.
Do you feel any burning or redness?
Nope.
No? Okay.
Okay, can you double check?
So we're gonna just do that. So that's good, so we can go and bring the medication.
I clamp this. Watch for 5 drops. So 1, 2, 3, 4, 5. Make sure that everything is in good spot. Not kinks or anything. Alright.
So, gonna
How are you
clean it
feeling,
again.
Shanna?
I'm feeling good.
Okay, so no infiltration, no irritation, no redness. So that means we don't have any allergic reaction going on here. Now, can you tell me the side effects I told you? Not side
Just
effects,
clean
but,
for 15
the
seconds.
adverse reaction to watch for?
Yeah, you told me about, I think it was anaphylaxis, about
Okay.
how my throat would swell up and I wouldn't be able to breathe and I would be itchy.
Okay. Alright, so make sure you
So-
let me know about that.
And then
some, like,
If you
common
feel any
side effects
redness
that you
or
might
if it's
get is,
burning
like,
you or anything,
dizziness,
just let us know to call us. Can you state some of the things that I just taught you?
If it hurts or if it's red or burning.
Okay, that's good.
I want to tell you that
So,
if you do
we're
take
also, so since we have this, we're gonna
antibiotic
mark
at
this
home,
to 30 ml.
you
So
would have
let
to
me
complete
switch
the
it
whole
here.
treatment, okay? Don't stop, because
30
you don't
ml.
want to
There you
create
go.
any, drug-resistant bacteria.
and then just unclamp everything.
Now I'm gonna label the tubing, the IV setting, the rate, the date, the time, my initial for both
And then
of the tubing.
And then don't
so
forget the
next
5
nurse
drops. What you, it's basically, you know,
Label should change.
before you leave the room, you're gonna see the 5 drops. So you just count 1 to 5 and then, so you can see that ID is flowing. And then I'm just gonna chart this.
Okay, and I do have a teaching right here, little teaching paper I can give you so that you can look over the side effects and the symptoms I told you
So
about
put my initial.
for imipenem, and
So right forearm.
call me if you need anything else. I'll put it right here, and you have your call light right here. All right, if you need, just let me know if you need anything else.
So it was given at the right forearm. Patient reported
Do
no signs
you have any
of
concerns for me right now?
redness or burning.
No, not right now.
Okay, your call
It
light
was
is right
30
next to you.
ml
Give me a call if you need anything.
per hour,
Alright.
and a teaching was
I'll be back,
provided.
in about 30 minutes to double check, and then in an hour to
Okay.
continue the.
I don't know what happened there.
Alright. And then before I leave, I need to document, which I already have. Okay, now I am out of the room.
medication that you went over before administering medication?
Yes, definitely. First, like I said, I would check her, I would check her allergies, which she has to sulfur
Okay,
drugs.
so that's
It's
given.
not,
Okay.
contraindicated
So now I'm gonna go and get my antibiotic
for
ready.
the normal saline.
So
And then
we're gonna
before
do
I
another
actually
safety
give her
check
the
here.
medicine
So
for her IV patency, if it
hand
was blocked,
hygiene.
then I would have to maybe change it up or give her a new one.
and then we're gonna try to pull
Also
it up
double
here.
check with the pharmacy and the drug guide to make
So
sure
we're gonna
that
make
I
sure that we
could
have the
give
green light for it.
the dose within that rate and dosage range for her condition.
So did this information affect your decision to administer the medication and then how you administered it?
Yes, because if she was allergic, I would have to withhold the antibiotic and then call the doctor to get her maybe a new one. And then another one would be checking her IV
So,
site.
we have
If
the
it
green
was
light.
blocked, then
Good to
like I said
go.
before, I would have to remove that one and give her a new one. And
Okay.
for,
And then we're gonna do the 5
I have
rights
to
again.
double check with the doctor
So, and then
pharmacy
just check the
see
back for
if the
expiration, what we did earlier, any
is
leaking, if it's punctured, it's not cloudy, looks good, and then we're gonna make sure it is the right patient, the right med, the right route, the right dose, and the right time. So, okay, we're good on that.
Oh, we have 2 minutes to get back.
So just check the medication. And then I'm just gonna puncture this. So we're gonna make sure that this is kink. It's close, clamp, and then the cap is sterile. So this is also gonna be sterile. Put it in there. Okay. It's good to go. And then I have my alcohol wipe here. I'm just gonna clean this for 15 seconds. And then my this can get also clamped at the moment since I'm putting it in the antibiotic. As you can see that this is sterile, it has a cap.
I've set it aside so that we know to give it away and give it back. So did we crush something?
Looks like they're about to have free food downstairs.
Yeah, it was already ordered. I have no idea what the oxygen was.
Looks like they said it's gonna start
And
in
then
June.
just
so
use a
about 10,
backwash
15 minutes.
method.
The prosthetic department is putting on a little display or something.
maybe Mrs.
There you go. That's good. So no things. And then with your antibiotic, you want to have this hanging higher.
Yeah, I put it in there. Like the tubing? What about the bag?
And then this is gonna go here.
I think I put it in there.
So that's good to go. And then I'm just gonna do another safety check since I have this hang. So we're gonna check if it's the right patient, the right med, the right time, the right dose. Okay, and that's good. I can go ahead and unclamp this. And then since our antibiotic is gonna go at 100 ml.
Hold on.
Okay, that's it. And then before I unclamp it, I'm gonna chart it, and then we'll let it go. So, that's good. This is good. And we can go ahead and unclamp it. I already had the green light, so I'm good to go. I can just chart it now. Okay. And then make sure you see the 5 drops. And then also I have the little sticker here. And I'm gonna go ahead and chart it, and this is gonna be unclamped also. So I can go ahead and chart this. So let's say 8 o'clock. My initials. It was given on the right forearm at a rate at 100 ml per hour. And then I will provide the patient teaching. And right forearm. Okay. So this is good, and then I'm just gonna save it. Okay. So Miss O'Connor, if you have an anaphylaxis reaction, you know, where you're itching or and if you feel nauseous, vomiting, diarrhea, or you're having some discharge, to let us know. Would you be able to state any of those things that I just taught you?
If I'm nauseous, itching, or diarrhea.
Okay. And do you have any pain right now?
No.
Okay. I'm gonna bring the call light next to the patient. So that's a call light. And then make the bed to the lowest position. Okay. Is there anything else I can do for you?
No.
Okay. And then I'm just gonna perform hand hygiene. Okay. Good to go.
Were there any pertinent pieces of information you reviewed before administering the client this medication?
Yes, we looked at her urine analysis, and then we monitored her temperature.
Did this information affect your decision to administer the medication?
Yes, since she had an elevated white blood cells in her urine, and then her temperature was elevated, that just, told us that she indicated that she did have an infection.
Did this information affect how you administered the medication?
It did not. The medication was still given through IV.